do you have a sense of, when you're talking about the disparities, how much of that is a result of lack of health care versus personal choices versus just not being educated on what is a healthy choice versus a non-healthy choice? And is there, I know you obviously have a lot of work to do, but do you have a general sense of that as you go into this?
Good afternoon, Michael Ashford, State Rep Toledo. Let me share with you some statistical information. 27.1% of African American adults between the ages of 18 and 64 in the state of Ohio are uninsured versus 15% of Caucasians. 22% of African American adults between the ages of 18 and 64 are enrolled in Medicaid versus 7.8% of Caucasians. 37.5% of African Americans between the ages of 18 and 64 in Ohio have hypertension, which is high blood pressure, and I'm one of those folks. That is a rate of 40% higher than our white population. So statistical information say that across the board, African Americans in the state of Ohio are more greatly affected by removing the Medicaid expansion. So when we're talking about almost including 275,000 people, probably a large percentage of those are from the urban core areas in the state of Ohio.
Just to pick up a little bit more on the question, there have been numerous studies that have been done, including the Institutes of Medicine, that quantify and qualify that the disparities go beyond whether one has insurance or not. You can be a very high income, highly educated individual that has been exposed to the best that society has to offer, and still, as African Americans, Native Americans, Latino, Hispanic, and Asian Americans have disparate conditions. There are issues with respect to treatment modalities that are used for some and not for others. I've spent a lot of time with Dr. Quinn Capers up at The Ohio State University, who is a cardiologist, who has also studied treatment modalities that physicians will give to those with cardiovascular disease who happen to be people of color that are different than those modalities given to people who happen to be Caucasian. So there are differences that are being prescribed, and in some cases that exacerbates those disparities. So it's not just about whether you have insurance, it's not just about whether or not you have access, it's not just about whether or not you are educated about diseases and illnesses, or whether it is your lifestyle. It goes to the kinds of treatment you get when you go into the hospitals, into the doctor's offices. And that's why HHS, the U.S. Department of Health and Human Services, is really focusing in on culturally appropriate services for racial, ethnic populations, the class standards, cultural and linguistic appropriate standards for the provision of healthcare services.
Where do you go from here now that it's out of the budget? How do you work to persuade them to put it back in? And, if you can't, then what do you do?
Representative Hurd, that I'll follow.
It's a very challenging situation that we find ourselves in, because this is something that has not only had the most comprehensive coalition around any issue that I've been aware of in the time that I've been involved in state government, but also we did actually have bipartisan support. Yesterday there was a rumor floating around that there was bipartisan support in taking Medicaid out of the budget. That is absolutely false. Never has been. There was bipartisan support for passing Medicaid expansion in the state budget. Where we go from here is to continue to do exactly what we have been doing. There has not been a moment that we have not reached out to the Speaker of the House, to the President of the Senate, to our colleagues across the aisle in leadership, to try to establish the dialogue around how we maintain this and how we get a bipartisan collaboration for the budget, for the passage of Medicaid expansion. The problem has not been an interest in doing that. The problem has been a lack of response and inclusion in this process, which is unfortunate, because we have an exceptionally unusual opportunity here to do something of paramount interest and necessity to the citizens of Ohio, and we are foregoing that opportunity. And this goes beyond, the right thing to do, absolutely the right thing to do. But, my concern at this point really is not about what your philosophy is. There are so many ways that we can approach this from what is the right thing for the state of Ohio. And if you just want to have a fiscal conversation about this, are we going to forego between $13 and $20 billion, depending on whose numbers you're looking at here? Are we going to fail our hospital systems, who absolutely are not going to be able to absorb what's going to happen come January 1st of 2013? And are we going to continue to allow our resources to be attributed to other states around us because we're not stepping up to the plate? This is the second time in this administration that this has happened, and we're looking at, hundreds of millions of dollars the first time, tens of millions of dollars this time. And this is something that if we fail to do this right, not only are we failing people on a personal level and from the health perspective, but we are failing the state severely from a fiscal perspective as well.